Hey everybody, ahead on our Monday town hall, Pfizer says its shot is safe for kids 5 and up. The vaccines could be approved in a matter of weeks. We'll have an expert here to answer questions that many parents are asking tonight.
Plus, your questions answered after a thorough squishing of the fish in Florida. Julianne's Monday mailbag is ahead.
And the state of the mayoral race in Buffalo, with just about 6 weeks to go until Election Day, we're going to have an exclusive first look at a new poll.
We are glad you're with us. And first up on today's town hall, something parents, of course, have been following closely. Pfizer said today that its vaccine is safe and effective for kids ages 5 to 11.
Yeah, the company put out a press release saying that its trial involving more than 2,000 children found that the vaccine was, quote, safe, well tolerated, and showed robust neutralizing antibody responses. Now, we should point out the doses in this trial for the kids were smaller than those given to people 12 and older.
And there are still several steps to go before kids would actually start getting the shot. So here are the phases of approval. Manufacturers put the vaccines through multiple phases of trials to gather data. So that's what just wrapped up with Pfizer for kids. Next comes the FDA's Vaccines and Related Biological Products Advisory Committee, which will review that information and then make a recommendation for the FDA to either approve or reject.
Likewise, an independent committee also reviews the safety and efficacy information for the CDC to issue guidance on how that vaccine can be given. Once a vaccine gets approval from both the FDA and the CDC, then it can be given to the public.
And joining us live right now to talk more about this is Dr. Nancy Nielsen, Senior Associate Dean for Health Policy at UB's Medical School. Dr. Nielsen, great to have you back.
Thanks, Kate. Good to be with you.
So people want as much information as they can get before they make, an important choice about the health and safety of their children. Explain to us, as you read through this press release, and you've warned us before, this was just the press release. You haven't seen the data yet, but tell us your impression of what Pfizer announced today.
What they announced was that they measured antibodies after giving the vaccine, and they used a vaccine dose that was 1/3 of the vaccine dose given to people 12 and older and adults. So it was a smaller dose, but the kids got an immune response that was every bit as good as that achieved with teenagers and young adults. And why teenagers and young adults? Because they have the most robust immune system. As we age, that begins to diminish. So this is really very good news if you just look at measuring the antibodies. And we've seen that the antibody levels seem to correlate very well with protection against severe disease. So it is good news, but as you point out, it's a press release from the company that made the vaccine. So let's wait for the scientific analysis.
And the reason that Pfizer said it had to measure antibodies is because, quote, given how rarely children become severely ill, the trial was not big enough to draw meaningful conclusions about the vaccine's ability to prevent COVID or hospitalizations. So we have two questions there. Does it seem like the method will ultimately be accurate? And does all that kind of undercut at all the need for the vaccines in the first place?
I think it's going to be accurate, yes. And I don't know how that would undercut the need for the vaccine. We don't want kids ending up in the hospital or in the ICU, and we certainly have seen that across the country. Over 5 million kids have gotten this infection, and the rates are rising dramatically since the Delta variant has become the big variant. So this is going to keep, it looks like this will keep kids out of the hospital, out of the ICU, and that's great news.
Dr. Nielsen, for a while, getting a lot of the population vaccinated meant that a lot of mask rules went away. Does it seem like that is something that we could see change if kids, 5 and older, that's pretty much all kids in all grade levels of school except maybe preschool. Do you think that maybe that would enable us not to have the mask requirements in schools if we can get enough kids vaccinated?
Well, it would, and that would be what we would hope. But remember, you're dealing with parents who've already said they're reluctant to not only get the vaccine themselves, tragically, but also even more reluctant than that to give it to their kids. I would just remind you that, truly, if we were in this situation back in the days of polio, we would still have polio in this country. As a colleague of mine said, we're not asking people to storm the beaches or give up part of their liver. We're asking them to get a shot. And that's what we can do as adults and teenagers to protect the kids until the vaccine is available for them.
And I want to talk a little bit more about that, because you talk about the reluctancy, but we've also heard from people out there who are willing and enthusiastic to get vaccinated themselves, but they are more hesitant when it comes to their kids. And a Kaiser Family Foundation poll last month found only 26% of parents said that they would get their 5 to 11-year-olds vaccinated right away if approved. So what more can you say to them or reassure them?
Well, I would say that the side effects of this vaccine are no worse, and in fact a little bit milder than the side effects of the vaccine for older people. We know the antibodies protect. I really hope that we can get back to normal where kids are not wearing masks. You're not going to be able to do that until there is enough of the population vaccinated that we're not going to have to worry about this virus anymore. So it's going to be one of those things where, frankly, it probably is going to be mandated by states for entrance into school. That's what I would anticipate. You've heard the debate that, well, this isn't something you can have a national mandate for. School shots those are determined by the states. Absolutely. So let's get the states to have at it, because that's how we'll get back to really what's normal.
Dr. Nancy Nielsen is Senior Associate Dean for Health Policy at UB's Medical School and a friend of the show. This was big news, this morning. A lot of parents have been following this very closely. Thanks for helping us make some sense of it.
Thank you.
Always appreciate it. We're going to stay on the topic of vaccines tonight. We asked our Verify team to look into all the claims we've seen online regarding whether or not the shots are given to Afghan refugees coming here to the U.S.
We know more than 300 of them are scheduled to relocate right here to Western New York. Matt Gregory reports.
To begin with, resettling refugees is no easy task, let alone doing it in the middle of a deadly wave of COVID-19. However, our research shows the refugees are being screened and vaccinated against COVID-19 and other diseases. Earlier this month, the Virginia Department of Health reported several cases of measles among Afghan refugees. It got people wondering, are the refugees from Afghanistan required to get vaccinated from COVID-19 and other diseases? Let's verify. We went to the Department of Homeland Security to get the answer. A spokesperson told us Afghan refugees are required to be vaccinated against measles, mumps, and rubella, polio, COVID-19, and whatever other age-appropriate vaccinations are required by the CDC. If the refugees have not had those vaccines, they will be given them. The only exceptions are for medical reasons, and DHS takes those on a case-by-case evaluation. So we can verify, yes, Afghan immigrants are required to get several standard vaccines, including the COVID-19 vaccine. If they don't have proof of the vaccination prior to arrival, they will begin receiving the vaccinations when they get here. There's another detail the Department of Homeland Security sent to me. They said each refugee is tested for COVID-19 when they get here. And according to DHS, they're taking every precaution to slow the spread of the virus. With Verify, I'm Matt Gregory.
Thank you, Matt. And if there's something that you want us to verify, we hope that you'll reach out. You can email or text us.
Yeah, send a message to verify@WGRZ.com or a text to 716-849-2220.